Okay, hi everybody. We're back here for another one of our pandemic updates in place of our hip fests. And this time we're very happy to have Marini Pirpiris from Melbourne, who's going to be talking to us about the use of total hip replacement versus hemiarthroplasty in hip fracture management. So first of all, Marini, can you just tell us a bit about yourself and your institution?
So I work in Melbourne. I work at three hospitals, the Royal Melbourne Hospital, Cabrini Hospital and the Epworth Hospital. And one of my interests is in trauma. I've been involved in trauma for a long time and taught on a number of bodies, including the AO group, an international group based in Switzerland, where the focus is really making good decisions for our patients relating to the management of all fractures, but particularly fractured neck of femurs at this point in time.
Yeah, that's a big part of any trauma surgeon's job. So let's get right down to it. So we're talking about displaced femoral neck fractures. And the standard treatment for a long time has been a hemiarthroplasty, which is just replacing the femoral head. But on now, and I think especially in Melbourne, a total hip replacement where they also replace the acetabulum has been popular for a while. Can you tell us, is the uptake of this changing over time?
Yeah, I think surgeons are trying to do what they think is better for our patients. And initially, as you'd be aware, many years ago, we used to perform a half hip replacement with not very good fixation in the thigh bone. And the Australian National Joint Registry told us fairly promptly when that was reviewed that that wasn't the most appropriate way of treating a fractured neck of femur, and we could do better. And then we moved to the half hip replacements, or the hemiarthroplasties as we call them, and they seemed to work pretty well. They had some limitations, they had some strengths. We liked them because they were shorter duration operations. They did not put patients through as much blood loss, we perceived. And we thought that the recovery period was a lot shorter, so they could rehabilitate quickly. And from the point of view of the longer term outcome, we thought that they were good because I think they were cheaper in terms of keeping the health system afloat for a longer period of time, particularly with an increased number of people having fractured neck of femurs. And we thought that was the most appropriate treatment. What's come onto the horizon is a perception that in the more active people, in the people that are not necessarily from higher level care facilities, in people that are walking much more ably, that a hip replacement may be a better option. And that was really part of the National Institute of Clinical Excellence and some of the suggestions they came out with years ago, suggesting that people that were more mobile, people that did not require a substantial support from walking aids, they were probably better served by a total hip replacement. So that's where the concept of that total hip replacement started. And it's really grown because of, I suspect, people's views. And I also suspect that there are more specialists that do total hip replacements on the trauma roster.
What do you mean better? What's better for the patient's point of view?
Yeah, one of the concerns with the initial half hip replacements or the hemiarthroplasties was that if the patients were walking long durations and spent a lot of time on their feet, that the metal that was sitting within the hip would sort of gradually erode through the remaining cartilage in the cup or in the acetabulum, and that would then lead to pain. So therefore, what the thought was that if people are more active and on their feet more time and they have a greater demand on their hip, then a hip replacement that also replaced the acetabular side would, if you like, circumvent that whole process and allow them a greater period of time before they needed any support related to wear in the acetabulum.
Okay, so total hips instead of hemiarthroplasties are probably have advantages for younger, sort of more active people with a fracture.
I think so.
Are there any disadvantages of a total hip? over a hemiarthroplasty?
Yeah, I think a total hip replacement is a much more intrusive operation. It takes more time. It involves a greater amount of operating on the bone and more bleeding bone, because we have to replace both the pelvic side, being the acetabulum with the new cup, and also the femoral side, being the thigh bone with the new stem. So that means more blood loss. It means a greater stress on the person's ability to cope, a greater physiological stress on the patient. And this is the natural discussion that's often had with the friends and relatives or families that come in with the person that's had a fractured hip, because they're very mindful of not overly stressing a person's physiology or their ability to survive an operation, so we don't make them worse.
So that's probably another reason why we're not using them in older, frailer patients.
Yeah, I think for an older, frailer patient, if you can determine which operation is the quickest and the best and lasts the longest with the least amount of blood supply and the lightest anaesthetic possible, I think that's a great combination. And if it's that one operation that'll see them out for the rest of their time here on the earth, I think that's a good option for them.
Okay. Now, there's another change. There's another sort of new invention that's come on the market, and this is a type of total hip replacement that's called dual mobility. Just for the viewers, it's sort of a smaller ball within a bigger ball within a cup, and that increased sort of flexibility is meant to give you sort of better range of motion and less dislocation. So what's the story with these dual mobility hips? Are people using them much? Should they be using them?
So that's the great unknown. So there is a thought at the moment that the dual mobility hips may help minimize the number of dislocations that people have after an operation, particularly with people that have fractured hips. I mean, we know, and you know, you're one of the directors on the registry, but the registry tells us that one of the reasons for revision when it comes to people that have a fractured hip is dislocation. And when they have a revision for dislocation, it's often related either to a stem revision, which is the thigh bone, but the reason that the dual mobility cups have, I think, gained a foothold in the space is because surgeons think that they can minimize the number of revisions for dislocation, so they can have fewer dislocations so that patients don't need more operations. And I think that's the space where the dual mobility cup has come into its own. But based on some data that's not there at this point in time, there is some series that suggest that it may be a good thing, but we really don't have a trial that compares similar populations in the same way to tell us whether the added time at operation from a hemiarthroplasty or the added expense to do a dual mobility as compared to a hip replacement is a worthwhile undertaking.
Yeah, it's a good point, because they are more expensive too, aren't they? So
correct. Yeah, I think they're a more expensive operation.
Yeah. Okay. All right, that's been excellent. I think that's a really good update. Hopefully those in the Hip Fracture Network will get something out of this. Marini, thanks very much for joining us. I hope to see you in person soon, sometime.
Yes, hopefully once we're through COVID. Yeah, absolutely. Thanks, Ian. It's been a pleasure.
All right. Thanks a lot.
Bye.